Where we live, learn, work, and play affect our health. Although New Hampshire is the third healthiest state in the nation, the County Health Rankings Report tells us that it's not what state you live in, but where you live in that state that matters. The County Health Rankings Report highlights health factors and outcomes that influence the health of New Hampshire residents, and spotlights each county's pattern of strengths and weaknesses. This report provides data to leaders that will help them mobilize action toward community health. New Hampshire has identified the top 3 public health priority areas as obesity, tobacco, and substance use. New Hampshire has had many public health success stories. The stories highlighted here are prime examples of how individuals and communities can act together to change health behavior. Public health in New Hampshire: improving health, preventing disease, and reducing costs for all.
And I am the Lakes Region Healthy Eating Active Living Coordinator. We have 2 primary initiatives. One of them is working with the WOW Trail, Winnipesaukee, Wapiti, and Winnisquam. They have formed this amazing group who are working to develop trailways through the Lakes Region. Along Phase 1, we found an area in particular. We went in there and worked with some local business owners. One was the Napa Building, and in the back it had been all just destroyed. It was also overgrown and kind of shady. It just wasn't comfortable, and so we spoke with the business owner, and they cleaned up all the debris out back and agreed to let us paint a mural to try and spruce up the area so it was more welcoming. And we brought on a local artist.
Hello, my name is Aisling Pettipaw. We're here at the WOW Trail off of Moulton Street. There's several murals being painted here. On one side we did a train last summer, which was a lot of fun. A number of members from the community of all ages came down, and we worked together to paint a train with the idea of vegetables hanging out the window, trying to inspire healthy eating, active living. So the train idea came about. We wanted to do something active, maybe snowboarders coming down a mountain and different ideas like that. But when I came down and looked at the space, the actual building shape looked like a train to me. So it took some convincing, but then it just clicked for us. Get on the health train. So we created this really whimsical train with happy smiling vegetables all waving out the window, encouraging people to hop on and get healthy.
Public health in New Hampshire: improving health, preventing disease, and reducing costs for all.
Hi, my name is Judy DeMeo, and I was about 14 when I started smoking. My mother was a smoker, and I thought it was very glamorous and made me, would make me feel older and more mature and a part of the in crowd.
Permit me, Duchess.
Thank you, Poopsie. What is she smoking? The Duchess? Yes, what is it? Galaxy.
My mother would have her coffee, and she'd take a sip, and then she'd do a puff on her cigarette, and the smoke would just filter through the air, and that was so, so glamorous. And I wanted so much to be like her. I was finally able to quit when my sister had a stroke. She quit cold turkey, and she really suffered through it. It made me realize, that how dangerous this really was. I finally was able to do more than just give it lip service. I was able to finally say, it is my time to quit. The hotline helped me. They gave me encouragement. They gave me support. One of the biggest things for me that they said was the fact that you can do it, and it can be done. And while I was sitting there, daydreaming of having a cigarette, they would put it into a perspective that I could cope with it and I could do it. The education they gave me about smoking was very important. While I may have smoked all these years, I never get educated of the dangers of smoking, what it can do to you and to your lungs, to every part of your body. The support was done in a loving, kind, gentle way, and it really, really was. They didn't, oh, are you gonna smoke today? Type thing. It really was, yes, I understand. I've been there. I've done that. But you can do it. And that was the part that just, made me hold on to them. I looked forward to talking to them. I would write down when we were going to speak again and stuff like that. And that gave me like a time period, which I could hold on to. I could do this for however long,
Smoking, last thing you do at night is put out a cigarette and brush your teeth, and it's not the nicest way to go to bed. And first thing in the morning, within several minutes, you're lighting up a cigarette. You could smoke, basically at work, convenience stores, wherever, We used to light up walking to school. Of course, society looked at it differently. We were smoking inside the school building, and we were ninth graders. The janitors didn't say anything. None of the other adults said anything.
Well, if you like your pleasure big, smoke for real. Smoke Chesterfield, the king that has everything. Please.
I quit in '92 for reasons. I had a young son at the time. He was 3 years old. I picked up cigarettes about a year and a half ago, just one day, and that pack lasted me. I think I actually threw it out after the second day. But then that weekend I went out and bought another pack and just kind of snowballed back into daily smoking at that time. I saw an ad for the Quit line, and they tailored it just for me. That was what impressed me the most. They spent 45 minutes on the phone asking what my triggers were of smoking, asking where I was at now. How are you going to handle that when you quit? Do you smoke at work on break? How are you going to handle that when you quit? They went through all kinds of scenarios for me to help visualize what I'd have to go through. The Quit line helped put it all together for me as far as putting together a good plan on how I should proceed. Since I quit, within 3 weeks or so, I bought a bike. There's a great park in Nashua called Mine Falls Park with miles and miles of trails that you can run or walk or push a baby stroller or ride a bike. And I've actually lost about 12 pounds since I quit, because now I'm able to be active. It's a great thing.
Public health in New Hampshire, improving health, preventing disease, and reducing costs for all.
Hi, my name is Sean O'Brien. I am the Executive Director for Adolescent Drug and Alcohol Prevention Tools, as well as the Project Success Counselor at Linwood Public School. I also happen to be the facilitator of the North Country Regional Prevention Youth Council, which is made up of students from 9 North Country schools.
Hi, I'm Bob Thompson with the North Country Prevention Network. I coordinate activities up in the North Country related to substance abuse prevention. And we work with communities to try and encourage them to create healthy communities that aren't supportive of underage drinking and drug use.
Hi, I'm Lynn, and I'm part of the North Country Prevention Youth Council, and we help with the healthy awareness. And one of the projects that we did was Project Sticker Shock. And what it is we went around to local businesses and we put stickers on all the alcoholic beverages, and it was awareness of drinking.
Come to find out that there was over 1,000 cases of beer located within 100 yards of our school. So we went into the stores like Rite Aid and PNC, and right there on display were these cases of 30 racks, 12 packs of beer, and we put stickers on them warning people about the sale of alcohol to minors and distribution of alcohol to minors. And that really kind of made a big impact, and we did an article in our local paper about finding that many cases of beer, and it was kind of a wake-up call for me too. I've been working in prevention for many years, but didn't really realize how in your face it was right within 100 yards of the school.
We're big believers in youth leadership development.
I'm Jake, and what I did this year was I taught a class called Reconnecting Youth. And what we did in the class was we taught the effects of alcohol and what it does to your body and how it affects your brain and liver. And then throughout the year, we transitioned into team building activities. And in those team building activities, we just try to get everybody involved as much as possible, and they were just fun throughout the whole year. And
the more we can invest in developing our youth and developing leadership qualities in our youth, the more support we can get with the activities and action plans that are created in the communities.
So my name is Zach York. I'm actually part of a peer-produced program called Project DJ, where we actually have the opportunity to go out to different schools around New Hampshire around the North Country.
It's totally run by youth. They book the gigs, they make the phone calls, they show up at the dance, a middle school dance, a high school dance, and they totally run it. So it's a youth entrepreneurship program.
Our whole goal is to get them out there, so we MC it, we advocate for them to get on the floor, to have a good time. And it kind of just goes along with our whole natural goal and adapt of leading a healthier lifestyle.
Banner swap activity, that is when we'll exchange those pro-alcohol use banners with neutral banners that basically just says the North Country welcomes you, welcome bikers. And we find that the less exposure that kids have to pro-use messages, the less likely they are to drink. We know that if young adults and students start drinking prior to age 15, they're 4 times more likely to develop alcoholism than if they wait until the legal age of 21.
Public health in New Hampshire, improving health, preventing disease, and reducing costs for all.